Welcome back in. Fitz the Bill here on ESPN Richmond, and we're joined this Wednesday morning, as we are every Wednesday morning, Dr. Wells Stewart III from OrthoVirginia, taking some time out of his day to chat with us I want to start here because I was reading through your bio, and typically we like to start, whether it's knee, hips, things of that sort. I want to start here, though, about barbecue, because I read on your bio you're big into barbecue. You're from North Carolina. And I want to get your thoughts on why North Carolina barbecue sauce is the best barbecue out there.
Yeah, that's a loaded question, especially since I was born in Texas and
Oh,
big Texas family. But I'm not beholden to one. Any kind of good smoked meat, you got Texas style, your North Carolina, Memphis, Kansas City. As long as it's all good, any. I just like to eat and I like food, so I think they all have their place on the plate.
so are you more of a pork guy or a beef guy?
Well, I'll tell you, for cooking at home, pulled pork is so forgiving, so easy to do. Definitely, it's super easy. But a good brisket is like the holy grail. Often unattainable and tough to get just right. But when you nail it, it's good. And then you got to get your sausage in there, and even you need smoked turkey, all good too. So I like it all.
Yeah, and with Thanksgiving coming up, that smoked turkey is definitely on the menu. But we're joined now, Dr. Wells Stewart III, talking a little bit about knee and hip injuries, as well as you work specifically with knees and hips and things of that sort. I'd love to know how you decided that was where you wanted to kind of get your focus in on.
Yeah, so in orthopedics, you get exposed to a lot of different parts of the anatomy, but kind of honed in on hip and knee replacement is what I like. It's big surgery, so that's kind of do you like big surgery, small surgery stuff? But then also the functional outcomes with hip and knee replacement are very good. We really can help these patients have arthritic joints that have worn down either from injuries or just from too much wear and tear over the years. And we can really help restore their function, get them back moving again. They do very, very well. And so that's kind of, for me, it's that carrot on the stick is that patients do well and you make people better and they're happy with it. So that was the biggest draw to it.
Can you explain to me, as someone who thankfully so far in life does not have arthritis, I haven't had to go to the doctor about arthritis, explain how arthritis may impact a joint?
Yeah. So what arthritis is actually just the wearing down of the cartilage of the joint. So our joints, the ends of our bones are lined with cartilage so that when they're rubbing against each other, they have a cushion. And the arthritis is literally just the inflammation and wearing down of that joint, of that cartilage. And so once that happens, joint becomes very painful. We get bones rubbing against bones that aren't supposed to, and that hurts. And so really kind of as that sets in, it leads to stiffness, loss of motion. You can also have deformity that occurs, especially in the knee. Patients can become very bow-legged or knock-kneed because of their arthritis.
Dr. Stewart joining us from OrthoVirginia this Wednesday morning. And I want to ask you a question about LeBron James here. And I know it's not fully exactly what you're working with knees and hips. And I know you're not working directly with LeBron James or anything like that, just kind of providing a lot more expertise than what I have in my back pocket. He's been dealing with sciatica for like 2 months now. My producer, he has dealt with sciatica in the past, and he said there's no way that this would last 2 months, let alone a whole month. And he thinks LeBron James is using this as a way to get out of NBA action. I would just out of curiosity, how long does typically sciatica last? And I know that that's not necessarily you're not working with them, anything like that, but just doing a little bit more expertise than what I have.
Yeah, well, I'll start with I'm not sure LeBron is actually human. I mean, what that man has done is incredible. His body he's kept it in top shape. But to be honest, actually, sciatica usually lasts far longer than that, several months. When people have it, it's kind of a chronic issue that can be years, even lifelong in some patients because it's a nerve root irritation. So it's definitely not something that comes and goes very quickly when it sets in. There are cases where it will, but it's tough to say. But again, LeBron's superhuman, so hopefully he will get over it sooner because it's amazing to be able to watch him. I think he's maybe 41 this year. I mean, what he's doing is, literally unprecedented in sports. So.
Yeah, it's kind of insane. And if he wants to take a couple extra nights off, who am I to judge? As someone who
You just want to see him we want to see them in the playoffs, that time of year.
Yeah, and it
So
looks like with the way the Lakers are starting that they will definitely be in the playoffs thanks to Luca.
yeah.
I would love to know, why are hip and knee replacements two of the most successful surgeries at improving quality of life?
Yeah, so really that comes down to the restoring their function and mobility. A lot of these are not things that happen acutely over time. It's not like tearing your ACL where you have a sudden change in your life. These patients have had a slow progression. And then we do a sudden change with the surgery to go and fix it, and they can move better. We can restore their motion. And so specifically hip replacement is one that, I always joke with patients that when they ask me what they can do, is that Bo Jackson hit a home run in the major leagues with hip replacement, and so that's the goal, is that you can do that. You can restore that function, just get that the body can move again without having that pain and restore that motion. But I think when you look at the examples out there in joint replacement, I mean, Lindsey Vonn had a partial knee replacement, is back to professional skiing. Andy Murray had a hip resurfacing, which is a type of hip replacement, back to professional tennis. But the size of surgeries these are really impressive what we do. And obviously, almost none of my patients are athletes to that degree, but just getting them back to on the golf course, back walking the dog, back to running, jog, whatever they like to do. We've become very good at getting them back to doing those things. Granted, our bar is a lower bar than than a high level athlete who we're putting back in the NBA or the NFL.
Dr. Wells Stewart from OrthoVirginia taking some time out of his morning to chat with us. And yeah, maybe the bar to get your patients back to the professional leagues isn't the same. However, what we have seen a lot in modern medicine is a hip, a knee, ACL, something along those lines. It used to be a career-ending injury, kind of like Bo Jackson you mentioned earlier. Now it seems like these players, it might take them a year, might take them 9 months, but they're back better than they were before. What advances have we seen in technology that has made it where both with, your regular Joes and your professional athletes, they can go through a knee, a hip replacement, something along those lines, and come back even better than they were before? What advancements in modern technology have we seen to help with that?
Yeah, great question. I mean, there's several things that go into that. Specifically, a lot of it is technique driven. The expression, we stand on the shoulders of giants. We come from those. We improve on what people before us did, and so a lot of the early pioneers, especially, they were doing things and figuring it out, but now the people who come behind them get to say, okay, how were they doing? How can we make that better? You look at ACL reconstruction. It was, used to kind of be done an old transtibial technique. We were reconstructing the ACL, but we really realized we weren't doing it in the best way. And so even when you fixed it, they couldn't come back as well. But guys have figured that out and improved it because they're getting to build on. It's a natural evolution of improving our craft and our practice in medicine and surgery. And then so, that's one standpoint. Technology is also better in terms of the use of robotics, specifically in what I do with hip and knee replacement. We can be more accurate. We can customize what we do to patients' anatomy. And then there's other, the implants we use are better than they used to be too. We got a lot of really smart engineers designing these things, and they're being designed in more with, just again, improving on the prior models, say, hey, how can we make this better? And so that's kind of what we're working towards. And then there's other techniques where you can do muscle sparing surgery where you don't have to cut muscles, and that can speed up recovery as well. So, a lot of it though is just based on taking what you were trained on, what you learned, and then say, how can I improve that? And I think we do that naturally because we want the best outcome for our patients.
Dr. Wells Stewart from OrthoVirginia taking some time out of his morning to chat with us. And Dr. Stewart, what activities do you recommend for patients to strengthen their knees and hips after surgery, after they go through something like this?
Yeah, so absolutely. With the knee side of things in the early period, you're just really focused on range of motion, getting that knee all the way straight and bent. Then as you progress to strengthening, simple walking is fine. A bicycle is a great activity for the knee to get it moving, working on building that quad strength. I don't, recommend patients do a lot of heavy lifting in terms of that, but just body weight exercises. We've got to restore the strength of the limb to supporting the body first before we add those, and then the endurance, because there is a lot of atrophy that occurs even using muscle sparing techniques where the leg will get a lot weaker. We know for a fact that like an ACL patient, an athlete's knee is weak for about 8 or 9 months after surgery. Same thing happens with the knee replacement. So we've got to build that strength back up slowly. But generally walking, swimming, things that are going to take the weight off bicycle or swimming are going to take the body weight off and help them improve that the strength through the range of motion. Those are really good activities. I generally tell them to stay away from more strenuous things like tennis or pickleball or jogging for a couple of months until they're ready to get back to those things. So yeah.
Have you seen an increase? You just mentioned pickleball, and it jogged my memory on this. Have you seen an increase in hip replacements, knee replacements, injuries to those two joints since this rise in pickleball over the last couple of years?
I wouldn't definitely no. I wouldn't say I've seen a rise in hip replacements. I've definitely seen a rise in some patients real, maybe tweaking their knee a little bit, and then they already had some arthritis there, and it just exacerbated it and aggravated it. But I definitely see a few more people coming in like I twisted the wrong way because they're doing things they weren't doing. It's still it's a sport, and it requires quick movements and pivoting motions. Now, but we see a lot more Achilles ruptures, patellar tendons, things like that from pickleball. But in terms of people who end up needing joint replacement, thankfully, not too many of those, although some of the knees are getting made aware of their arthritis because of pickleball. So,
Yikes. Dr. Stewart, where can listeners go schedule an appointment, learn more about you guys with Ortho Virginia?
yes, I think our website, orthovirginia.com, it's scheduled online through there. You can also give us a call. Check us out on social media platforms, kind of get, stay up to date with what we got going on. Because we're a statewide program, about 150 of us surgeons across the state. And so pretty accessible, but definitely the website's a good place to start.
Awesome. I appreciate it so much. Thank you for your time. Have a great rest of your day.
All right, you too. Thanks for having me.